Welcome back to the anatomy series of videos. Up to now we've looked at the upper limb, the shoulder and the arm, and today we're going to go down and look at the forearm and the wrist and some of the intrinsic muscles of the hand. Once again we'll be using the 3D for Medical Complete Anatomy. You can follow along, and if you're struggling to get access, please contact the library. So let's jump right into it. Now we've looked at the bones of the forearm and the hand and the wrist. It's time to look a little bit more detail at the muscles. So we have quite a collection of forearm muscles, and most of the fine motor control of the hand and wrist actually occurs further up in the forearm. This is the view that we were left with after looking at the elbow. So we'll just take a few layers off. Brachioradialis muscle, which is a forearm flexor, and if you remember, this was most active halfway between pronation and supination, so we'll hide that away. This piece of tissue just here is the bicipital aponeurosis. We'll hide that, and then we'll hide the short-headed biceps and the brachialis muscle. Long head has disappeared as well. You'll remember from last time that these flared ends of the humerus are the medial and lateral epicondyle. So right up at the attachment point, we'll zoom in a little bit further, where we see the medial lateral epicondyle more clearly. We have a collection of muscles. We'll start with the lateral side, and this long muscle here is extensor carpi radialis. So if we have a look at its action, we can see that extensor carpi radialis is very active in wrist abduction, abduction. But of course, as its name suggests, it's also active in wrist extension. So to give it its correct name, extensor carpi radialis longus. Longus because it moves all the way down through to, as you can see, the distal phalanx of the fifth. Here we are back at the elbow. So let's hide away this muscle, and we'll just move around a little bit further, and you'll see here that we have extensor carpi radialis brevis muscle. So we've had longus, we've now got brevis. It makes sense that they do similar things. They do, but in a slightly different attachment point. So you can see that it's very active there in extension, but it has a shortened tendon, hence the brevis, whereas attaching here at the base, also involved in wrist abduction, along with its partner longus. Let's jump back. So we'll hide that away. Coming around again, we have a muscle here that we've looked at last week, which is the supinator muscle, and this works alongside the biceps muscle in this supination action. And if we can just isolate it for a second, you can actually see that it has two heads. And we'll just quickly look at its action. Simply a forearm supinator. You can see how those two heads work together. Notice that one attachment is on the lateral epicondyle and the other is on the posterolateral border of the ulna. So when the forearm is in that supinated position, you can see how the radius crosses over the ulna, and the shape of the radius facilitates that. It makes biomechanical sense that when this muscle, the supinated muscle, contracts, the arm is moving into supination. Move back and we'll hide that. Moving around again, we have a collection of muscles here which are involved in extension. So we've got extensor digitorum muscle. Let's isolate that and have a quick look. You can see how it actually diverges and spreads out across some connective tissue, which actually holds the hand together. It's very strong connective tissue. And we look at the motion. The very obvious one is extension of the digits. But we also have finger extension because it is a digitorum muscle. And we also have wrist extension. So a fairly busy muscle. Let's hide it away. And here we can see that we've got digiti minimi, which if we isolate it, you can see actually just attaches to the little finger. And of course, extensor carpi ulnaris, which is a reasonably strong muscle. And we can isolate this. You can see where this is attaching down at the metacarpals. And we'll look at its motion. We've got wrist adduction and extension. So even though this muscle is originating on the lateral, it's moving across and actually has a medial insertion. So let us hide these muscles. And we'll move to the flexor. But before we do that, we'll just quickly look at the anconeus muscle here. The anconeus muscle mentioned last week is an elbow extensor. It actually has a very broad capsular attachment, and it moves the capsule out of the way when the arm goes into full extension, so the capsule is not trapped. So moving to the medial aspect now. We had a supinator on the lateral side. We've got a pronator on the medial side, and as the name suggests, it pronates the forearm. And there we can see it in action. And once again, it has two heads, similar to the supinator muscle. One head is on the medial epicondyle, the other is on the medial border of the ulna. And you can see its partner at the distal end, the supinator muscle, which is working together, creating the same action. Flexor carpi radialis, as you might expect, has the opposite action to extensor carpi radialis. We look at this in isolation. We can see how it's starting medially but moving quite laterally. So this is clearly going to affect its ability to move the forearm and wrist. So we look at its motions. We've got wrist flexion and we've got wrist abduction. So abduction you can see there. And it's working together. With extensor carpi radialis. We can see the two actions working together. So it's worth remembering that in order to get abduction and adduction, we need a combination of the flexors and extensors working together. Let's just go back. And of course we have wrist flexion. Flexor carpi ulnaris, another large flexor muscle. If we look at it in isolation, we can see that it's a lateral attachment up on the epicondyle, quite a broad attachment because it moves into the ulna as well. So we've got the attachment on the humerus and attachment on the ulna, and is moving down and inserting on that pisiform bone or pisiform bone that we spoke about earlier. You can see how it creates a natural tunnel as well, which will be needed for security for the wrist and for other structures to travel through. We look at its action. We've got flexion of the wrist, which you would expect, and wrist adduction, wrist adduction. And again, just to emphasize that it's working in a pair. with extensor carpi ulnaris. So you may have worked out that essentially the extensors are on the lateral side and the flexors are found on the medial side of the distal humerus. Let's go back and we'll remove that, and we're left with just a few muscles of interest to us. So moving back over to the lateral side again, we have palmaris longus muscle. Now, palmaris longus muscle is actually not a particularly strong muscle and is missing in a certain 5 to 15% of the world's population. It doesn't have a massive contribution to wrist function. It does provide a little bit of stability, and it does improve the strength of grip a little bit. But it's actually very useful to surgeons, because if there are other tissues and other tendons damaged in the area, then they can quite often reattach palmaris longus in a different place to assist. In fact, if you just look at your wrist, and you can see that there is a very prominent tendon here, you can actually move it around quite easily. That is palmaris longus. Okay, so we hide palmaris longus. Now, a very big, deep muscle, or deeper muscle, is flexor digitorum superficialis. So of the two flexor digitorum muscles, this is the most superficial one. Just behind it, we've got profundus. So profundus is deep, something is profound, it's deep, and superficialis is on top. And both muscles travel down through what is known as the carpal tunnel and attach distally on the phalanges. The difference between the two is that profundus actually pushes through to the very, very end of the distal phalanges. Just going to take this opportunity to hide those two flexor muscles. There is one muscle left in here that we have an interest in. That's flexor pollicis longus. That's on the anterior side. And posteriorly, we have abductor pollicis longus and extensor pollicis brevis. Just hidden behind it, we've got extensor pollicis longus. So there are actually quite a few muscles here remote controlling the thumb. And between them, they contribute towards that opposable thumb that we have. Now, the muscles further down in the hand, we look at in a second. But if we can just quickly isolate them, you can see where these long tendons attach. Let's just put them back in because they're of interest to us. Now, the muscles of the hand will have varying degrees of interest for different professions. If you're into rehabilitation, physiotherapy, then quite a lot of extensive research will be done into the hand, and we'll spend a lot more time in practical sessions looking at it in depth. Just for now, it's worth noting that there is a broad coverage of muscles which makes the hand very soft, but also contributes to the grip available at the hand. So, pollicis brevis on the abductor and pollicis brevis on the flexor are very close to each other. They actually insert at the same point, but just by virtue of the fact they have a slightly different origin, they just contribute to the slightly different movement of the thumb. If there's a pollicis, there's going to be a digiti minimi of the small finger, a small digit, and of course there's an abductor digiti minimi as well. Palmaris brevis muscle makes up the hypothenar eminence, whereas the abductor pollicis brevis makes up the thenar eminence of the hand. Deeper into the hand, we have a series of other muscles. We've got the lumbrical muscles, and these lumbrical muscles, if we just isolate them, actually called lumbricals, they look like worms. And deep to them, we have the interosseous muscles. And these muscles are involved in finger extension, flexion, and abduction, adduction. So putting everything back, we zoom out again. We see that there's a lot going on there. Now, depending on your chosen route, whether you're in rehabilitation therapies, physiotherapy, sports and exercise sciences or coaching, you'll have greater or lesser depth to cover in these areas within the practical sessions. But for now, we've finished the upper limb. We've looked at the joints, we've looked at the muscles, and we've looked at some of the supporting ligament structures. There is one other area of the neurology which was briefly mentioned when we looked at the elbow. Depending on your pathway, you'll spend more or less time studying this in a bit more depth. But for now, that's the upper limb. We're going to move on to the spine and the lower limb next.